All right. Well, good morning, everyone. My name is Jeff Trice. I'm the Director of Business Development for VBS and VMS. I would like to welcome you to our very first webinar. I appreciate your time and energy today. We would like to, have this webinar so you can get a little background on our company and our outsourcing services that we provide and the great talent that we utilize to support our clients. We're going to have an opportunity to kind of, speak to, a couple of our principal owners today, hear from them and their stories. And we're also joined, by our CEO of the company. So, we have a firm foundation and feeling that we've built a great business here. We've been in the outsourcing industry for over a decade. And we really feel that we've dialed it in and do a great job of, for one, trying to relate to, our clients and fulfill your needs and exceed your expectations. So I'm excited for you guys to be here this morning. I would like for this to kind of be interactive. So we're going to have a Q&A box there. So if you have questions as you're hearing the stories being told and understanding our business platform, please feel free to, put a question in the Q&A. We're going to kind of cover those at the very end. So we'll make sure we'll try and get to all the questions at the very end of the presentation. But also, hey, if you're hearing something that you love or you like, we love that feedback. Give me a thumbs up or give a heart or something along the way. So I know you guys are out there. And then we're looking forward to hopefully having a touch base towards the end. So if with that, I'd like to maybe just go ahead and get started. We'll jump right into the meat and potatoes and value everybody's Friday here. And thank you for your time for joining in. Let's go ahead and get started with the webinar. So here, like I said, a little house rules. We do have everybody on mute for right now. I'm going to hopefully take you through a little bit here as the Director of Business Development is understanding, who are we as a company? I like to talk through, our mission and our vision statement that we have, which are both very interconnected to the culture of our company. Our CEO, Valerie Kenworthy, you'll get an opportunity to hear from Valerie, a very integral part of the culture and the heartbeat of our company. And then our, two of our principal owners, Dr. Jordy Levy, will have an opportunity to kind of speak, give you his story a little bit on the virtual medical staffing side, and then Chuck Rudolph. These guys are partners in arm, and he'll speak to kind of his indoctrination and their, joint venture, meaning him and Dr. Levy, how they were inspired to move forward and how we're going to take this company and our support services in the future, right? So we want to continue to be progressive in all that we do, and hearing from our principal founders today will be very critical, right? So, and then, as I said, as you're hearing their stories along the way, please feel free to put in that question and answer, and then we'll do a kind of a round robin at the very end and hopefully answer as many folks' questions as possible. And so you have hopefully by the time we're finished, you have a good understanding who virtual medical business staffing and virtual business staffing is, and hopefully how we can be supportive you in your business as you thrive and have the opportunity, for one, to have great talent to be a part of your team, but be smart about your business and leverage, this cost savings and, take away some of the heartache and the stuff you have to do with managing and leading a team each and every day. Let us take on some of that for you. So with that, let's kind of get into so you can understand a little bit about who we are. Next slide. So I'll give you this, guys. So who is virtual medical business staffing? So, we pride ourselves. We're a company with managed there. We're based out of the United States, but we procure our great talent out of the Philippines, right? So we understand that, the BPO industry is a foundation principle there. We understand that the culture of the Philippines and the work ethic, the education, that's there, it's paralleled pretty much it transitions very well to business platforms here in the States. So that's why we have chosen the Philippines as our centralized point for the talent that we bring on. We take care of hiring for you. I think I said this before. For the placement, the health insurance, taxes, and most of the HR needs, we take that on ourselves. We take that off of your plate. The firm thing, I think I talked about this, is that the thing that differentiates us between a lot of other outsourcing companies, that we onboard our great VAs as employees, right? So this is where we take that burden off of you, and we do the hiring, the benefits, the insurance, all that is on our side. So that allows us to support you. That's what we do for you. So we specialize, for one, in identifying, training, and managing talented individuals and connecting them with great companies and talented companies such as yourselves, that will help you with all your various staffing needs. Our goal is to connect a variety of businesses with well-qualified, trustworthy, and carefully screened staff members, providing top-notch quality in all of our services, right? So that's one of the things that's going to separate us from others, that we have a great vetting process. We ensure that we, really get to know those VAs, get to know our client, because as we get to understand who you are and what your needs are, we're able to get you the right person and the right fit for your company, not only with just a great skill set, but it has to be a personality fit, right? Those things are very critical in reference to who we are, and then who you are going to be represented by out there in your field of industry. So next slide, please. So critical, our mission and our vision. These are things that we hold very close, near, and dear to us. And, we want to make sure we abide by this in all things that we do. So I'm gonna read through it here. I'm trying to take it verbatim because I want to make sure that it's clear to everyone, what we stand for. So identifying, simplify, amplify, those three critical pieces there. Our team's core mission is aimed at elevating professionals and businesses by providing a workforce that is committed, efficient, cost savings, and a no-nonsense virtual assistant solution. I'll focus that on the assistant solutions piece. We strive to streamline all tasks, maximize productivity, and create a seamless virtual digital experience, allowing our clients, you, to focus on what truly matters. And that is you relating to your customer, your guest, and focusing on the holistic approach of your team. So that's our mission. And now our mission should very much align with our vision for our company. And that is to be a leading virtual assistant staffing solution that revolutionizes how professionals and teams approach work and personal tasks. We envision a future where technology seamlessly integrates with daily activities, simplifying lives and amplifying growth. Our commitment is to consistently innovate, identify opportunities, and simplify resolutions and exceed expectations. Let me pause there. Our vision and our mission is to, one, fulfill and exceed your expectations. And that's by getting you the right talent, that's going to fulfill and support your business. But, it's not just fulfilling a job, but we want to be able to supersede that, right? And exceed the expectations that maybe you have or you set for your company and for yourself. So that's our mission, our mission and our vision. And hopefully that will give you some clarity as to today, when you hear from our principal owners, where this all came from. So the next slide, please. So that's our mission and our vision. So here, as I stated, man, we're joined today by Valerie Kenworthy. She's our CEO. I smile here a little bit because I tell you, when you have somebody who's been with your company from day one, right, and understands every position along the way, and is very has a lot of great touch points, and is very well connected to our team. And when I say that, is that that means that they're going to be very well connected to our client and to the importance of your team as well. So Valerie has done everything from, first step to where she is today in the CEO, and really continues to bring us along. So I'd like for you to hear from Valerie, real quick. Valerie, good morning to you. Happy Friday to you. I'd like to maybe give you a couple minutes and give the team a little bit of history on who you are and the role that you serve in VMBS.
Yeah, thank you, Jeff. I appreciate that. I'm Valerie, and hello, everyone, and welcome to our virtual assistant webinar. I'm really excited to have you here today as we explore how virtual assistants can benefit your business, as it's done for us in the past for many years. In today's fast-paced world, efficiency and flexibility are key, and our virtual assistant services are designed to help you just achieve that. Throughout this session, you'll be hearing from, like Jeff said, the principal owners of the company and how they started it and how they can streamline the business. Throughout the session, we'll be discussing how the services can streamline your operation, reduce your costs, increase productivity, all while allowing you to focus on what matters most, growing your business. We encourage you to ask questions and see how our virtual assistant solutions can be tailored to meet your specific needs. I really appreciate you joining us today, and I'm excited to dive deeper into the future of your business here along with us at Virtual Medical Staffing and Business Staffing. So thanks,
No.
Jeff. I appreciate the introduction.
Yeah, of course. No, thank you, Valerie. It's always good to hear from you. And I always say Valerie kind of undersells herself a little bit. I tell you that the value she brings to our company and the culture that she's helped set, it really it translates over to the VAs that we bring on. And I tell you, everyone here is like a family, and Valerie treats us all as such, and that's how connected we feel that we are, and we would like to be for you as well. So thank you, Valerie, for being on the call today and sharing a little bit about yourself and the foundation of VMS and VBS and your role. Thank you. Next slide, please. So here, guys, here's the opportunity. I'm gonna shift a little bit and turn the floor over to Dr. Jordy Levy here. And the reason I'll turn over to Dr. Levy first, because virtual medical staffing was our foundation, was our start, right? Over a decade ago. And Dr. Levy had the foresight to understand and apply, utilizing outsourcing in his practice. I'm not going to steal too much of your thunder here, Dr. Levy, but I think it's important for hopefully everybody to kind of hear from you, maybe your origin story, and maybe answer a couple questions along the way as to maybe why virtual medical staffing and what the vision looks like based off of your perspective going into the future. So I'm going to give you this, Dr. Levy, give you about 15 minutes to kind of give the folks on the other side a little insight and to hear from you and your story. So Dr. Levy, I'm going to give you your time.
Thanks, Jeff. Appreciate it. Can you guys hear me okay? Yeah, sorry, my screen just changed. Yeah, thanks a lot for the time, and excited to have everyone here on the call. I've been working with Valerie for a long time in medical practice, and we've both been in medical practice for quite some time. We've been running our practice as a mobile house call practice. So we were basically seeing people all over the Phoenix Valley area in assisted living, memory care, group homes, private residences. And so there's a lot of challenges in our practice model just to be able to see the patients, coordinate, schedule, aside from just any model, any medical practice has challenges, obviously. And so, early on, we kind of had issues in just getting consistent staffing. And so one of the things and documentation, it's always been a battle for me to keep up on documentation, as Val can attest to. So, one of the things doctors have a challenge with is documentation. Things are changing to make that better, but we early on found the use of scribes. And so I started working with some scribes that I had found and worked with separately even before starting virtual medical staffing and virtual business staffing. And the scribes helped me tremendously stay on top of my documentation, have more time with families and patients, and really it was a game changer in that aspect. And so once we started using scribes, we kind of were using some other agencies to help us with a couple areas in the office. But it was like an aha moment early on in our practice. We said, hey, these guys are really solid. We're getting in the States, a lot of times you're getting medical assistants with, 3 to 6 months of vocational training and there, you can find some really strong MAs. So there's nothing, I mean, we still work with MAs in general, but, we were seeing that we were finding really talented people in the Philippines, a lot of people who were qualified with registered nursing degrees, with bachelor's degrees, RN degrees, people that had clinical experience in the hospital there. And so with that, we decided, and that's kind of how I got in contact with Chuck, the other principal owner, as he was kind of involved in doing other outsourcing. And so we kind of all decided, hey, listen, we are using it in our practice. Let's find a way to actually have us have more control over our quality, the people we hire, how we train them, how we make sure they're HIPAA compliant, how we do all of our background testing, like all the stuff. Because when you're working with other agencies, we were having trouble and some gaps in certain areas of hire quality assurance, and we felt like we didn't really have the support we wanted. So that was one of the biggest reasons we even started virtual medical staffing, was a way to actually be able to work with and identify really talented people directly in the Philippines. So that's how it all started. It all started from us having some experience with some other agencies, and then feeling like we could do a better product, and that's how we grew. We ended up starting with scribes. We then expanded to working with other areas in our office. And so at first there's always that hesitancy. Is outsourcing going to work for me? You know, we had a large medical practice, a lot of lives depending on us. So like anything else, we wanted to make sure that the model works. So we went in little by little. The scribes were doing a great job. So we said, okay, you know, we're having a bottleneck with our scheduling intake department. Let's go there. And so next thing you know, we started hiring people, and they were doing a great job on the phone. They were helping us get medical records faster. They were helping us to organize all of our back office processes. And then we started hiring people in billing teams. Then we started hiring people to help with, we started a whole chronic care management program, which is something, if you're not in the medical field, that's a big thing, where you're able to actually bill out for services where you help to coordinate coordinated care when people get in and out of hospital, managing their chronic conditions, communicating with specialists in the field. So we did all that. And so as we started using it more in the practice, we were able to actually incorporate more best practices and change our process flow, improve our phone call triaging, improve our response times to families. I mean, it changed how our practice worked. So it went way beyond what I initially thought was just, okay, let's get some staff here to like help with a couple problem areas. Because they were so strong, we were able to expand our what we were doing. And because the cost was what's much more cost effective, that was a big thing too. So we were able to identify people quickly. I think this was all happening even before COVID happened. And so, as we all know, with COVID, there was a huge staffing crunch and a huge difficulty in hiring people. And so that was one of the things that we really realized, hey, thank God we have the people in the Philippines to help to staff these positions, because we would be in a position where we would be having gaps in care and ability to even execute the way we needed to execute without some of the people in the Philippines. So it's kind of evolved and grown from there. And as we evolved in our own practice, we started off kind of grassroots, meeting with other doctors and physicians in large practice in Phoenix, and they kind of realized, hey, this is great. I had other physicians that we helped, and we grew our model from there. And then expanding from there, we've gone in multiple different states, multiple different industries. We've gone from primary care to specialist care to physical therapy, occupational therapy. We work with ACOs. We work with specialty practices. I mean, we really work with the full gamut of people in healthcare industry. And we also work with non-healthcare in the business arena too. I mean, I focus more on the medical side just because I'm a medical doctor, and that's kind of where the spirit of the company started. But we obviously do things throughout other industries as well. And the whole idea is that you're identifying people, hiring talented people, getting them placed quickly, and how you have a modifiable workforce, which can be really difficult in the States to hire people, to get people up and running in a timely manner. So, and obviously there's a lot of turnover too. So when we've had turnover in the past, it's sometimes very difficult to get people to place. Sometimes you're waiting a month, 2-3 months in waiting for an American, like a medical assistant or an intake person. Sometimes it can take months to reposition someone when they leave. In the case of virtual medical staffing, virtual business staffing, because there's such a huge pool of all the applicants we have throughout the Philippines for different positions, we're able to like plug and play, get new people positioned very quickly too. So that's a huge thing that made a big difference in our company. So the whole idea of having someone there and available, the whole idea of having a modifiable workforce really was a game changer for our company. For me too, working with the people in the Philippines has been a great thing. We've had people working for many, many years for us. I mean, we've got, like tenure in our company. We don't have in our practice, we have people that are tenured longer working from the Philippines than we have in anyone from the United States at this point, because we also have some long tenure people there too, but there's been a lot of dedication to the company. There's been a lot of unity. The way our model works really is when they're hiring people, when you're hiring someone, they become really a big part of your organization. So these people, the people that we hire in the Philippines are really embedded in our organization. They're part of the flow. They're part of the relationships. They're involved in like the camaraderie, you know what I'm saying? So really it's not just like hiring someone to execute like some task, and they're kind of like they're actually part of the organization. Now, that being said, we also have been opening up what we do to actually execute tasks and do like projects. So we have that project piece too, where say that you want an organization like ours to just execute a project. That's another option. So we've been kind of evolving as a company, and I think it's really been a big thing to have the resource of the Philippines there. I really don't know how I would have grown our practice. So we initially started as a small practice with a couple providers, 2, 3 providers. We've now grown to a practice that's in 3 states with over 22 providers. And 22 to 25 providers. It's always in flux there, but it's something that would have been very difficult without having that workforce behind us. And it's something that really I couldn't imagine having accomplished what we did. We started our own mobile medical practice. We started a hospice company. We merged with a larger hospice organization that has a lot of bodies under care, and they're actually out of like 6 different states. And so all this was, I think, more possible because of what we do. And also that large organization that merged with us also has been incorporating a lot of outsourcing. So it's just, I think it's just a part of what we do in business now. It's a part of the paradigm. And one of those things that I would say is going to be continued. I think that with COVID, because technology is great, because Zoom works, because all the different VoIPs work, and with all the security we have, it's also makes it more of a feasibility to do what we're doing. So, kind of I probably have a little more time here to go over stuff. I guess questions too about, I mean, with regards to what it means to me. I feel like working with the the people in the Philippines has always just been something that I think it's a great thing to know that you're helping people in their upward mobility too. I mean, a lot of people say, well, I don't want to give jobs outsourced because, there's people in the States. Well, we obviously still have people in the States, but the way I look at it is that not only are the people in the States happy about it too, is that you're giving them resources. A lot of the people working in our offices were so spread thin. So, I mean, especially in the medical fields, we're all spread thin. We're all exhausted just getting through our workflow. I mean, it's rare that there's a medical practice that is just overstaffed. I mean, it's possible, but most medical practices are not overstaffed. There's always some area where they're spread thin and they have to really work hard. And the overall feel is that, people are really stretched in the medical world because of the way that reimbursement and staffing and costs are. And so you're still supporting your American staff by hiring people in the Philippines because they're actually there as a support for them. And you're growing the company together. And on top of that, you're supporting people in the Philippines. They're really thankful for the jobs. I mean, you're giving them an opportunity to not just be on a phone bank doing insurance assessments. They're actually doing clinical work. And that's a cool thing for, I think, the people in the Philippines. They really like to be involved in clinical care and clinical work if they have a clinical background. So it's not always easy for them to find jobs where they're able to still incorporate that piece in their life. So it's a big win-win for the people that work for us, for our clients, and kind of those kind of things. So I could keep going, Jeff, but I guess we can.
No, Dr. Levy, no, I appreciate it. Thank you. It's very insightful. And I appreciate, and always good to hear from you because, you really get to the core of, one, your own story and how you utilize, VAs in your practice and how we've grown to utilize and, allow our team to support others, right, in their business. And you mentioned a couple great things in your story there is, I'll talk a couple key words is retention, family, growth of business, evolving, right? Collaboration happens. Us being in the forefront of technology and allowing technology and resources to be there for your company, whether you're a single entrepreneur or you're a Fortune 100 company, those are a common thread for all. And that's, as you heard from Dr. Levy, that's a part of his story and some of the things that are important to us as a part of our foundation and ensuring that you can leverage those resources so you can do the same as you hopefully have a partnership with VBS and VMS, right? So Dr. Levy, thank you so much. I really appreciate you giving us and sharing some of your time and your insight. And it's always great to hear from you, my friend. So thank you for that. Well, I'm going to pivot here a little bit, and we'll go to, go over to Chuck Rudolph, our other principal partner. And as you heard from Dr. Levy, he talked about some of the medical staffing side, right? The medical side and that principal foundation there. And Chuck has kind of been there along the journey with Dr. Levy, and maybe he can give us some insight to Chuck's story, and also maybe the other fields of industry that are more diversified, based off of his perspective of the company and where we're going and what we are going to do. So I would allow Chuck. Chuck, I'm going to give you your time to talk to the group this morning. So Chuck, I'll turn it over to you. Thank you this morning. Happy Friday.
Yeah, thank you, Jeff. Thanks each and every one of you for joining today. I just want to take up a little bit of your time. I know everybody's busy, but back in 2005, I've been an entrepreneur most of my, well, probably since I was 13 years old, but most of my adult life. And owning a business is difficult. It's really hard, especially a small business. You're strapped with becoming a jack of all trades. Not only are you the bookkeeper, but you're the marketer, you're the manager, you're just trying to figure out how everything works. In addition to that, you have government regulation, the cost of minimum wage going up. So back in 2005, somebody referred me to a website because it was based on these web developers that were out of the Philippines, and I had gotten some quotes to do two websites for a couple of my companies, and the cost was just outrageous. So after I looked at this website, I remember specifically I hired a gentleman out of the Philippines named Ermin, and Ermin was professional. He was prompt. He nailed it right out of the gate, and it cost me a fraction of what it would have cost if I hired an American firm. So I got to thinking, this is pretty good. This is like a win-win. I'm paying him more than he would normally make, maybe working for a call center, and he's providing me a great service. Now, fast forward, about 10 years later or so, Dr. Levy approached me, and he started to use an outsourcing company, and he says, "I know that you've used outsourced workers before. Maybe we should look at getting our own for my medical practice." So I reached out to Gilbert Anaya, who's our head of operations, who ran an HSBC call center and a Santander call center, and I knew they did it out of the Philippines, so I kind of brainstormed with him, and that's how really virtual medical staffing was born. When Gracie came on, she has family in the Philippines, and she put us in contact with a tremendous legal team out there to make sure that we were doing everything right. A lot of companies out there, they will hire an independent contractor, and they'll kind of fly by the seat of their pants, not knowing that if something goes bad, something goes wrong with that particular, let's say it's a data breach or anything like that, these companies don't have any sort of retaliation or any way to punish these independent contractors. So it's very important for us to do it right the first time. How it's transformed my business, because I have a consulting firm, is it's incredible. My virtual assistant, my executive assistant, has just been an absolute rock star. And when I started to look and call in for various customer services like Google or Amazon, or calling my health insurance, United Healthcare, even Verizon, I just continue to see this pattern of these big Fortune 100 companies outsourcing to the Philippines. And it just further kind of cemented that what we were doing, we were on the right track. Because as I mentioned before, business is difficult. Regulations are difficult. Increased minimum wage. And in California, there's companies closing down because they just don't have the, I don't know, they not have the bandwidth, but they don't have the profit margins to be paying their American employees these $21 an hour, $25 an hour just to stay competitive. And so having the access to global talent via the Philippines, it just gives you a leg up on all your competition, in my opinion. And Dr. Levy mentioned it, it's win-win. If we can provide a greater standard of living for our VAs in the Philippines by paying them, 1.5 to 2 times more than they would make, let's say, working for a Verizon in a call center, and we could pass that savings on to our US clients and they could save 50 to 70% on their payroll, it doesn't get any better than that. It's a win-win. It's truly a win-win. Because of the time difference, depending on the US client, we could have 24/7 support for your business. If you need somebody to answer phone calls past 5 o'clock, we can provide that solution. It'll boost your productivity as well, because our Filipinos, our VAs, they show up to work. They are reliable. They are professional. They are intelligent. They are hardworking. I can go on and on and on. This leads to the managers and the CEOs to stay really focused on their core set of tasks every day, to have them go through their emails, a VA to go through their emails, to return phone calls, to set up a travel plan for you, make reservations, all these little things that would cost an American assistant, 3 to 4 times the amount. It just makes common sense. And I can't say this enough. Outsourcing on the surface may seem very, very difficult, but we provide the solution to make it very, very simple. It's easy to do, and of course it's easy not to do. But by the fact, if you choose to do the outsourcing and give it a shot, we have one client who was so excited about outsourcing. He wants to figure out how to bring the Filipinos to the United States on a visa permanently, to replace his American RNs, to replace his nurses, to replace some of his staff. That's how excited he is. So I urge you to get more information from us and give us an opportunity. You can start off with one and see how we perform for you. So I'm just excited about this opportunity. And Jeff, I'm going to pass it over to you. I know I didn't take up a lot of time, but I know everybody's busy.
No, hey, thank you, Chuck. It's really about the thank you so much. It's about the quality time that you provided us, and very insightful. And for me, guys, I once again, the nuggets I always pick up from Dr. Levy and Chuck whenever I get a chance to speak to them, which is pretty frequently, right? So because we are like family here, for the clients and you guys out there today, is like you wear multiple hats. You're juggling. Your time is sometimes hamstringed, and there's not enough hours in the day, right? So if you can have a win-win scenario where you're able to have and onboard a model employee, have a company that is going to have resources to either have a client liaison or have the resources behind you. So if you need something and your VA is doing well, or whatever the case, or you need to onboard additional, we have a team of resources that are there for you, right? And Chuck said it, is really, you have rock stars that are a part of our team, and we'll find that rock star for you that's going to exceed your expectations. And the key things about running and operating a business, and you guys know this as business owners, is how do you boost your productivity by still controlling your payroll? And if you can get a cost savings out there that's going to exponentially save you 60 to 70% on your number one cost factor, and that's payroll, you can reallocate those funds to grow your business. That's the resource that we're going to be able to give to you. I say this here, and I think Chuck said it as well, and I think it's even on our website. We invite you to go to our website. Sometimes it's so simple, it's common sense. It really is. But Dr. Levy said it, so did Chuck. I think in our mind, when we think of outsourcing and being able to utilize another resource like that, we think it's very complex. And there are a lot of intricacies to that. But that's what our company has done over the decades or so. And we've understand the industry. We know how to simplify it and make it a seamless operation for you, the potential client out there. So you can focus on what your number one priority is, and that's growing your business, having the resources that allow you to grow and take you into the future, right? So I thank you once again, Chuck and Dr. Levy, for sharing your stories and giving us some insight and those golden nuggets there. So I would like to maybe pause there for a second. I know we probably have a couple questions that have probably been queued up, and we're about 40 minutes into our presentation now, into the webinar. Maybe I can take a look at some of the Q&A and maybe answer a couple of questions that are kind of out there in the market, and ask and answer some of those for you. So, and maybe I can toggle them over to either Valerie, Chuck, or Dr. Levy to answer any of those questions. So, at this time, I'm gonna toggle over and see if there's anything in the queue in the Q&A. Let me take a look here. And I encourage you guys, as you're attending out there, and please raise your hand, and I can recognize based off of in the attendees and the participants, to raise your hand if you got a question. I'd be more than happy to call that out or take a question from the group. So let's see here. I do have a question here from Wayne Davidson. The question is, how can businesses identify tasks that are best suited for delegation to a virtual assistant? I would probably say, and I'll say the question one more time. How can businesses identify tasks that are best suited for delegation to a virtual assistant? Maybe this question, maybe Chuck, would you like to take on this question, or maybe Valerie?
Yeah, I can take it if you want.
Thanks, Val.
This is a very great question. And so one of the best things that you would do to identify is, where are you struggling at? What is happening in your business that is not working how you want it to working? Are the phones not being answered correctly? Are presentations not being done correctly? Do you need scribes? Is this a medical business aspect of it? What is hurting the most in your business that we can help fix that for you? And so that's the answer that I would put to that question.
Yeah, no, thank
And
you, Val.
I would piggyback. Sorry, Jeff. I'd piggyback by saying, look at your business model, and ask yourself this question: what employee does not see a customer face to face? What employee doesn't have to drive to see a customer or drive to do something? So any of those customers or employees that don't have to do that, they should be really analyzed and looked to be to add a VA to that position.
Yeah, I mean, in our practice, obviously, people in the Philippines, like a nurse practitioner, an MD, a PA, you have to have a certain credential to be able to bill for services for clinical visits. So yeah, of course, they can't bill for a clinical visit, but they can help with any of the support structure, the back office work. They can essentially do anything from that standpoint that's not a non-billable event. So, which is pretty much the majority of what happens in the office, your scheduling, your intake. They can do billing, they just can't bill for services. So, and I think one of the things too is that we identify different people. One of the good things about our company is that it's the whole idea of matching. I think this is what makes our company a little bit better and more unique than some of the other virtual companies out there. We really go out of our way to match. So if you're identifying a person who's going to be like, you want someone to do like quality assessment, they call it QAPI work, quality assessment work, to do like chart reviews, and you want a person who's like, we try to find people who, that's the kind of work they like to do, that they're good with spreadsheets, that they're good at data analysis, that's going to be one of their fortes. Other people are going to be on the phone more, so they're still doing patient contact. They're still face to face to patients, or they're still on the phone. They're not. They're outreaching. So you want that person who's going to have the right personality match to be on the phone, to have good. Almost, one of the things too is they all speak. We all find really good English people. I mean, some of the people doing the phone services, you can barely even notice an accent. We really work hard and to identify. So we find different attributes to different people in the Philippines for different roles, and that applies to the medical and non-medical business. I think that's the whole idea of being. That's our whole job really as a staffing company, is to match the right fit. It has to be a right fit because they are becoming, like I said when I was presenting earlier, they're becoming a part of your organization. So you're not going to hire some like crotchety person to be answering the phone. Hopefully you're not, I mean, you want to have the right personality, but that same crotchety person might be the best person to sit there and just rip through spreadsheets. I mean, it's like any business. You have to really work hard to fit the right person for the right role. And that's one of the things we work at. So.
Yeah, no, thank you. You're right, Dr. Levy. Fitting the right person for the right role within that culture. And, it's so very important. That's what we do. We identify that right talent. We do have another great question, from Philip Calloway. Philip asked a question, do you work on the East Coast? Philip, I'll tell you this, we work on every coast. And Chuck said this earlier, and I can let Val elaborate a little bit, but, our talented team, from the Philippines, they will work the time zone that our client works in, right? So I think Chuck said we work 24/7, right? That is the coverage that we have. So it doesn't matter if you're Pacific Standard Time or Eastern Standard Time or Mountain, whatever your business may need to do that particular work or reach out to your clients, we will align their schedules based off of your business need. So yeah, Philip, I would say, do you work on the East Coast? Definitely we do.
And we have people staggered time wise too. So in the medical, we have on-call people floating 24 hours. So they're floating at night. We have people taking night calls. We have weekend coverage. We have weekend calls. So depending on your needs and what kind of business you have, you can stagger people. You can have different. It's a nice thing because call centers and call coverage you pay a lot for. You end up paying a lot of money to actually use a call company. Now, the nice thing for us is we've hired our own people to take a lot of these calls, so they know they can help answer these questions right on the spot too, versus just taking a message and stuff like that. So you definitely.
And not only that, for the 24/7 aspect, they also are working on our holidays too. So with no extra holiday coverage pay that you would have to pay here in the States. So yeah, 24/7, 365 days a week. So however you want them to work, they will work.
Yeah, no, thank you, Valerie. Man, I love the participation here. And these are some great questions. We do have a question from Mike Roberts. Mike's question is, what are the key benefits of using virtual assistants in a business setting? Right. So great question, Mike. I'll read that one more time. What are the key benefits of using virtual assistants in a business setting? May I, Val or Chuck, would you like to take that question? Maybe Chuck?
All right, I was on mute.
You're on mute. That's all right.
I think, gosh, there's a number of benefits. First and foremost, I think the big one is the cost savings on payroll. That's big for small businesses. That's big for any businesses. Like I said, the big Fortune 500 companies are saving millions and millions of dollars by shaving their or cutting their payroll costs. Another benefit would be freeing up your time as an executive or as a business owner, or your managers, having the ability to supplement your American staff with, the bandwidth is sometimes run thin. And then if American staff member calls in sick or doesn't show up, you have that backup. So, cost benefit, time, getting your time back, being able to focus on growing the business. Those are just some of the many benefits of having a VA.
Mm-hmm. Yeah, but even if I'll say this, and we all work for a couple of reasons. And for one is so we can provide to our friends and family, right? And our family. Getting time back is one thing that is a very precious commodity out there. And having the resources that allow you to utilize your time better and accomplish things in an expeditious time frame. And that being able to get that work-life balance and having resources that still allows your work, your career, or your business to still flourish. Sometimes people are working on weekends. They're working till 11:30, 12 o'clock at night, and they're up at 5 in the morning because that's what the business dictates. If you have resources that you're allowed to allocate out at the right times and you plug and play when and where you need them, getting time back, to your family and to your health and wellness is a huge benefit outside of exponentially growing your business. I firmly think that's a huge value, is being able to gain time back. So, I would say, Mike, thank you. That's a great question. And I think those are a couple definitely key benefits. So thank you, Chuck, for pointing those out as well. I'll continue on. We do have another question that's in the queue, and we'll be able to take a few more here. So Catherine Kelly, this is a question from Catherine Kelly. Catherine's question is, how does a virtual assistant differ from an in-house employee in terms of responsibilities and expectations? I'll read that one more time because I think that's a great question. And how does a virtual assistant differ from an in-house employee in terms of responsibilities and expectations? If I may, because right from the beginning, I like maybe Valerie, could you answer maybe give your insight on, that question, and how does a virtual assistant differ from an in-house employee versus and responsibilities and expectations?
So in responsibilities, there should be no difference. An in-house employee can do exactly what a virtual can do, and vice versa. If COVID taught us one thing, it was how to work in a virtual world, right? And so expectations for me on just my experiences is that I can expect more out of a virtual than I can an in-house employee. That's just the truth of the matter. I have the virtual show up all the time, like Dr. Levy said. They are proficient, they're working, they're asking the right questions, they're not sitting on the phone, they're not playing games on their phone. I don't have to do those type of coachings with my virtuals versus my in-house. So for me and my experience, I think that the virtuals do a great job at keeping those responsibilities and expectations for me high. I put them at a higher bar, and they do a great job meeting them.
Yeah, thank you, Valerie. And I'll say this based off of our in-house team. And, once again, I said we bring those VAs on, those virtual assistants on as employees of our company. So, we have filters in place that ensure that they are happy in their workplace. We have a client liaison that really touches base with our client to ensure that those expectations are being met, and sometimes obviously super to be exceeded as well. And only way for us to know that, like I said, the expectation is always inspect what you expect, right? So there should be no difference in work performance or expectation of a virtual assistant versus somebody who's there in front of you. They are there to exceed your expectations and hopefully knock it out of the park. And that's the type of talent that we vet and secure for you kind of going forward. So, great question, Catherine.
Within the organization too, the virtual staff actually do have different responsibilities too. I mean, we have tenured people just like everything else. We've had people who have been with the organization in our medical practice, for example. We have an MA who's been with us for like 8 years virtual, and they've taken on a role, like a leadership role, where they then train other people that come on. So they'll help to train the new MAs that come on. They manage teams. They've essentially taken on like leadership roles within the organization, almost like a manager would in departments. So we have like a kind of a tiered structure. We have like people, American people who are like team leaders and managers. Who, let's say there's 2 team leader billers that are kind of like certified coder billers in the United States. Then underneath they'll have 3 of the senior billers, and then underneath another. So we kind of, like any other organization, there's tiers to people. There's different experience. Different people that you hire are going to have different roles. So we have organizations that are using the people from virtual staff for like we one of our large clients uses them in a variety of roles within their organization. So like we've done in our practice, they're using them for compliance work. They've hired paralegals over there. They've hired people to do billing work, and within that they have different they kind of train and work with others with them. So I think it's definitely they can definitely handle the responsibilities based on the role they're being hired for, essentially, just like you
Yeah.
would for an American staff person. So
100%. And one of the things we pride ourselves on is a lot of the VAs can grow into leadership positions, right? As you potentially maybe growing a team of support that's behind you that might be virtual. There are leaders that understand that dynamic and have those responsibilities of leading teams, right? So anything you can think of in reference to roles and responsibilities outside of me handing you something physically, they have the opportunity to
and
fulfill
that's the
those.
cool thing that we found when we first hired these guys. We found the ones who wanted to be leaders, who were strong, and then we were able to train the new hires through that virtual by the people that we hired virtual. So it's almost like the organization feeds on itself and grows, and
Mhm.
it's a nice thing. Yep.
It is. Here's another question that just rolled in from I think I'm going to say it right, Maya Painter. So Maya's question is, who handles the training for the online staff? It's almost a two-part. We have then there's a statement. We have a practice in Texas. Go Texas. And we are planning on getting online staff. So the question is, who handles the training for the online staff? And they're looking to grow their company in Texas. So maybe Valerie can maybe answer that question, kind of who handles the training for the online staff. You can get some insight to Maya on that.
Of course. Great question. So we do the onboarding, we help with the HR, we do all of the back end stuff for you, but we want them to learn your processes and the way that you run your office. And so it's like any hire. You would train them for 1 to 2 weeks on what you would like them to do based on your processes, and we just support you from the back end. And again, with that would be with HR issues, that would be HIPAA. We put them through the HIPAA certification for you, so we don't have to waste time with that. We also do all of their compliance and all of their cybersecurity compliance. So that way that comes out of it, and you're just teaching them your process of how you want them to do the work.
Yeah. Thank you, Valerie. And
So
one of the
they become your full-time employee. So, you are hiring them to be a full-time employee. You're going to put them through all just like we've done in our organization when we grew our medical practice, they become, they become part of our email servers. We have them, they have access to the hospital portals to download medical records. They're part of they're enrolled in our EMR, essentially they are integrated within the practice. And so just as you would hire an American staff person, you're going to put them through the HR steps. You're going to put them through your training, all the compliance stuff that you would do for an employee, because and we have people all over the country. So some people are on Athena, some people are on Elation, some people are on
Dr.
Practice
Chrono.
Fusion,
Yeah.
Dr. Chrono. I mean, we've got people in different
Epic.
practices. So we find people now. Let's say you do have a certain EMR, AMIA that you're going to be that you use. One of the things we can work on, and that's part of our job to place people, is that we try to let's say you're using Athena or whatever practice, whatever EMR you're using, we try to find people without experience, ideally, and so that's, if we can identify people on certain softwares they're using, we try to do that. So that's part of the matching process. And let's say it's a scribe, we try to find people with scribe background. Let's say you're looking for people for intake billing, we try to find people with more intake billing background. If whatever that role in your practice is, you're growing and you're going to be using more online people. That's our job, is to match the people to fit the roles you have. And hopefully if they have some background that matches your EMR, but essentially they're going to come in, you're training them, they're your full-time employee. And so that's the whole idea, is that they're becoming part of your organization in that way. You're not just parsing out a task. Like, there are billing companies out there that you pay to be billers for you, right? This is a case where you're hiring the people to be part of your organization directly.
Right. And then those
100%.
VAs will train the VAs that come in after them. So you have that kind of synergy. So as you keep growing your practice with the online VAs, those VAs will then have their own trainer there. So your in-office staff can take care of the tasks that they need to.
Yeah, and that goes for any field of industry. So the great thing that we pride ourselves on doing is listening to the potential client. What is your scope of work? What are your needs? And be able to go find those talented VAs that have that experience, that have the skill set, whether it be to work with a particular CRM, or that has done this field of work. Maybe they've done accounting work. Maybe they've been in the medical field or worked in a dentist office, whatever that may be. As we listen to you and find out what that job description is and the scope of work, that's where we take that off your plate. So when you're talking about training, it's just really about your onboarding, as you would do an orientation for anyone that you're welcoming to be a part of your company. But we try and qualify them up front based off of the scope of work and the skill sets that's required for you and your company. So Maya, thank you for that. That was a great question. I think if I wasn't able to answer everyone's questions here, we'll have those in the queue. We'll do some follow-up via email and contacting and reaching out to each of you to ensure that your questions are answered. But we're almost at the tail end of the webinar. I wanted to thank you all for your participation. I would like to, at this point, leave on the screen here a little bit. So there's some contact information from that you can either take a screenshot or, take it here. We would love to hear from you. And this team is here to answer your questions. And so we can be a resource for you. So for one, that you can get time back. Secondly, so you can leverage, some payroll cost savings. Secondly, that you can have a staff that's going to exceed your expectations in no matter what field of industry that you happen to specialize in. We've been doing this now for over a decade. We're prideful in the teams that we have out there that are a part of other great companies, such as potentially yours. And we're excited that you guys were able to log in today and be a part of our very first webinar for VBS and VMS. And I'll thank you once again, Chuck. Thank you. Thank you, Dr. Levy. And always, thank you, Valerie, for your participation on today. You're being insightful. As you see, now you finally got to see my face there. So, I'm Jeff. Thank you, everyone. Have a great Friday. We hope to hear from you soon. Please reach out and enjoy your weekend. Be well.
Thank you, everybody.